So tell me about yourself and how you're involved in the health industry.
Well, indirectly, professionally, I work at IBM. Those mentioned representing IBM and work in high-tech e-commerce. That's my background. Digital marketing, electronic commerce for 20 years. And then that's my vocation. My avocation is healthcare. So I joined the Camino Hospital district board about 6 years ago. My father had been the third chief of staff there at the hospital, so always been interested in healthcare, but just could not be a service delivery person. But I'm interested in it from the data point of view. This is why I work with my whole career is data. And so how can we really drive more high-quality data-driven decisions in healthcare? And we're seeing a big change over the past decade that people are starting to corral the vast amounts of data to try and identify best practices based on data, not on just qualitative perception.
That's one of the big things that I see is the data.
Yeah.
And I see that's where most of the innovation is probably going to start with healthcare, as really in data.
Yeah.
So what are you seeing with the data? Mostly what I'm seeing is like medical records and that sort of thing. But is it more than that?
Yeah, well, the medical records, if you had concentric circles at the beginning, is at the middle. There's big challenges with HIPAA there. Is how do you strip off that personalized data so you can do the anonymized analysis, but it makes it very difficult there. And then, trying to aggregate that data. We've seen Wall Street Journal do some analysis when they've been able to strip out some of the data where certain regions would have multiple times the intensity of back surgeries or hysterectomies, and just based on local tradition, trying to identify that. But the interesting thing is we really haven't tamed the data we have now. We're about to go into these personal devices and sensors.
Right.
And that's going to expand the data again by orders of magnitude. So that everybody, if I can keep track of my heartbeat every single day by just wearing a device, or when I'm running, or if I'm diabetic, what my blood levels are. So that's going to be just another order of magnitude of data. So that's going to be fascinating to see how people, are we going to be able to establish standards? All these device manufacturers have their own data structure. And I don't know that there's the U.S. government or the global agreement is there's any standards. How can you aggregate that data to try and learn more to help save lives and improve people's quality?
Yeah, I see that's one of the big areas is standardization.
Yeah.
So I don't see anything standardized. I've seen PDF files, I've seen proprietary files, I've seen everything. And I don't see really any kind of a real standard yet.
Yeah, it always ultimately comes down to who's got the money to drive it. So it's either going to be a big insurance company that maybe is going to tell all these device manufacturers, hey, feed me this data this way, and can I give you some value for it? And the insurance companies, if they can get enough data and find out here's patterns that I can reduce costs of care, which reduce my costs as an insurance company, maybe they're the people that can help drive that standardization. There's got to be somebody that's going to have some money or some incentive to really push that. But yeah, you're right.
Yeah. So what do you see like the future of healthcare technology? And is it in the mobile devices, or it is in big data, or is it both, or what do you think?
Yeah, I think it's yes. When you get the mobile devices, that creates more data for the big data. The other interesting area is that as far as I can tell, I'm not an expert here, but the major systems, sort of the ERP systems of hospitals to manage hospitals, they're all still traditional on-premise software. And whether it's because of the concerns over security and HIPAA or whatever, that haven't really seen the expansion into the cloud that we're seeing with everything else. SAP, all the other IT systems are going SaaS, and you haven't really seen that as much in healthcare.
So all the ERP systems and
the Allscripts and the Epics, and those are some of the big players there. They don't seem to be really have active. They seem to be. This is often true in healthcare, as you know. They're further behind the rest of the IT industry.
Right.
But they seem to be 5 years behind, and that they don't really seem to be coming off with SaaS offerings right now. And that just, to me, that's
surprising to me. I would have thought there was a lot more SaaS there.
As far as I can tell, these big systems aren't. And again, whether it's because there's HIPAA constraints and the performance is harder if you have to encrypt the data, I don't know. But they just seems like they're further behind, and so these implementations are still these sort of like SAP kind of implementations from the 90s. These DECA, if not $1 implementations over multiple years, and so that's going to be an impediment for change, I think, for people.
So do you think it's more of a money issue, or maybe it's HIPAA, or maybe?
Yeah, I just don't know where it is, or whether whether it's just not the motivation, whether people haven't pushed it, but just haven't seen quite as much of that yet. So it's been interesting to me as I've been hearing about that.
Okay.
Yeah.
So what do you think is needed in? I'm big on mobile devices.
Yeah.
What do you think of this? What do you think of the mobile devices, and is that going to be the big thing?
That's spectacular.
Or what do you think is going to go and happen with all of that?
Well, there's so many layers in which the mobile devices can help. So, for example, we find one of the big issues that the government's really emphasizing for hospitals anyway is readmission rates. People leave the hospital, and their hospitals aren't going to get paid when people come back in 7 or 30 days, and rightfully so. If they're not healthy enough, shouldn't be discharging them. But so a number of issues arise there. One is when people leave the hospital, even if you do a great job trying to explain to them what they should do, it's a very emotional time, and it's hard for them to fully understand what their directions are. And so a lot of healthcare providers are spending a lot more time following up with people, letting them know, hey, are you doing X, Y, or Z? So the mobile device is going to make that much easier. You can SMS, just give people short text messages. Also, there's various numbers that maybe a third of people aren't taking their medicine properly. And again, they're not trying to be ornery. They just forget the exact directions. They forget how to do it. So you can set up your iPhone or your Galaxy to remind you when to take your medicine every day. And when you can then maybe a reminder to record it, so then you can see how often they're really taking their medicines, or they're doing their physical therapy, or whatever. Again, another great source of data. You could correlate that. Okay, the people that didn't follow the proper regimen had an X% higher return to the hospital. And so you can start to capture that. So no, I think you're exactly right. The mobile devices are going to have a tremendous positive value, I think, on the healthcare.
Mm-hmm.
Absolutely.
Yeah, I think so too.
Yeah.
And now there's the big thing, which is whether it's going to be iPhone, Windows 8, or Android.
Yeah, well, you've always got that battle. And again, if you can get some standard, like in the IT industry, RosettaNet for a while was a group that did a lot of IT standardization, so you could get these XML documents sent back and forth. Or you've got the SEC in the financial industry. It's probably going to need, at least in the U.S., to be the federal government to sort of come up with these XML kind of standards to force people to be able to export data via API so they can see them in the same format.
Mm-hmm.
And then be able to take that and also put it into different user interfaces and all of that. But yeah, the ability to access this information, and this is the tough one for the government. How do you pay doctors for their time if they're doing email or they're doing messages? And that's been one of the impediments to the adoption. For a doctor, I get paid for my time. Okay, well, if I don't get paid for an email, it's a tough motivation for them. Mm-hmm. And so as we move into more accountable care organizations, and hopefully this idea of more capitation in a sense. Hopefully we've learned from the 90s and the HMOs where people sort of stopped delivering or really starting to ration care, but make sure you just try to deliver care proactively. In the 90s we didn't really have the vehicles to test people proactively and remind them, and whether it's diabetes or whatever, to give them the information ahead of time. But now we do have, to your point, on the mobile devices. So I think but again, if we then can start to pay organizations for just for health care, not sick care. Right now doctors get paid when you're sick. Hopefully we can move more to health care where you're getting paid ahead of time and there's incentives to more cost effectively serve people. Yeah, then the doctors can respond to emails. Also you have the aspect of letting the nurses respond. The nurses can respond to a cold. making sure you sort of up level, so the doctors are dealing with the most complicated diagnostics. Again, a lot of studies showing misdiagnostics are one of the biggest impacts on poor quality of care. So how can you start to track that and give people a learning loop for these doctors? Okay, well, I just told 10 people this is what they should do. Well, 6 of them it didn't work. Well, maybe I'm not diagnosing that properly. And then they'll be supplemented, as you identified, the big data, sort of the Hippocrates, start to expand that more and more into giving people guidance on their diagnostics is going to be incredibly valuable too.
Yeah, okay, thank you. So is there anything else you would like to say?
No, I think you've hit on the big thing. I mean, it's just this massive spectrum from the devices, small data, aggregating it into the big data, and then again across the continuum of care. It's sort of like 9/11, where all the responders were on different wavelengths.
Yeah.
The firefighters and the police, and so it took a big disaster to get them to move on to that. We're still haven't completely got into that, where you've got hospitals on one system and physicians on another and home health care providers on another. So that point, our ability to get some standards to share that data to really benefit from all the way from the tiny little devices up to the mega, the Walmart-sized databases. I mean, that's going to be a big key for us. And whether that's going to take 5 years or 25 years, hopefully we can make it closer to the shorter.
Yeah, I hope that happens sooner rather than later, and I hope it doesn't take a disaster for it to happen like 9/11.
Well, you hope not, but they always use there's a quote in the healthcare industry that takes 17 years for a new capability or device to get fully adopted by the industry. Now, that's true in all industries, but just healthcare is a little bit slower. And you can see somewhat there's greater risk.
You have all the FDA regulations, and they want to make sure that whatever you're doing doesn't hurt people.
Well, that's it. I mean, you understand. Yeah, if it's in the IT industry or food, well, there's not as much risk. But healthcare, lives are at stake, so you've got to be a little more conservative. Yeah,
whatever you do, lives are at stake. So if you do something incorrectly, somebody might die.
Yeah.
Or they might get seriously injured or hurt.
No, exactly right. And then, of course, the other variables, the personalized medicine. So a whole other data set is, okay, well, I learned all about this, but how do I overlay this with my genetics are different than your genetics? And so you start to find out that, certain pills work for certain genetics, and that's now multiple orders of magnitude and even more data that you have to try to reconcile, and that's probably going to be another generation or so until we can really apply that fully.
Yeah. Okay. Well, thank you.
Great. No, thank you.
Yeah.